Well, following protests over the death of 35 babies in a matter of 2 weeks at a government hospital in Srinagar, the government has ordered an inquiry. But what really went wrong? Zafar Iqbal reports.
बच्चस परेशान हो करान ये करान नर्स रोजे डॉक्टर डॉक्टरस पेवान 3 लट गसन ऑलवस पस कश यवान तमिस ये पन्नी मर्जी गस अदि.
A devastated family recounting the horrors while taking back the body of their 3-day-old baby, the latest casualty at Srinagar's GB Pant Hospital. The family says the baby died due to alleged negligence of the hospital staff and inadequate health equipment. The lone children's hospital in Srinagar has become a death trap. In the last fortnight alone, 44 infants have died here. Inside the hospital, mounds of garbage and animals roaming around. And this is the intensive care unit, overcrowded and cluttered. The unit has just 5 ventilators and many babies sharing the space and equipment.
पिछले 2 रोज से यहाँ पे हैं तो मैंने जो चीज़ यहाँ पे नोट की वो ये है कि यहाँ पे जहाँ पे एक बच्चे को अडॉप्ट होना चाहिए था तो वहाँ पे 2 बच्चे एक साथ रखे गए हैं. तो
A probe ordered by the government has found shortage of equipment, serious sanitation issues and a casual approach by the administrators who earlier tried to downplay the crisis.
Figures calculate करते हैं census में, that is the overall population. तो इसमें तो कोई मेरा ख्याल कोई ऐसी कोई बात नहीं है, nothing to कोई पता नहीं किसने ये बातें उछाल दी हैं.
The superintendent has now been relieved of his duties. A senior officer will look into administrative issues and give daily reports. Procurement of equipment will now be fast-tracked and the strength of nurses and paramedical staff is being increased.
The government has ordered an inquiry into the death of infants, but on the ground, there's no change in the situation. Babies are still dying inside the hospital due to alleged negligence of the hospital staff and lack of facilities. People want results. And how soon the government will be able to deliver those results and bring the hospital back on track is the question. In Srinagar with Sheikh Tariq, Zafar Iqbal for NDTV.
Omar, you're visiting all the wards, you're seeing the situation. What did you find?
Well, clearly there is enormous scope for improvement. Visibly, the levels of cleanliness are extremely poor. The need for greater maintenance of hygienic and sanitary standards, greater discipline in the hospital vis-a-vis the presence of attendants in the wards. There is some requirement for staffing at the higher levels. Certain decisions have been taken yesterday, the process of implementation of which has started this morning. And all I can do is assure people that within the next week to 10 days, they will see a visible improvement, not only in the appearance, but more importantly, in the functioning of the hospital. Clearly, we need the general public to cooperate with us as well. While the hospital is responsible for maintaining proper healthcare and cleanliness standards, clearly the attendants with the patients also have to help us, and we will enforce those guidelines as strictly as we need to.
Do you have the NDTV Profit app? All the markets, all the news and your own homemade, ready-made portfolio available there for you.
We will right now answer what you should sell, what you should buy when markets are down.
Download at ndtvprofit.com/apps. Get the best app from the channel you trust.